Good afternoon, dear students. The topic of our lecture is Differential Diagnostic and Methods of Differential Treatment of Inflammatory Kidney Diseases. Inflammation diseases of the kidney. Inflammation of the kidney is called nephritis. In Greek terms, nephro means of the kidney and itis means inflammation. The causes for nephritis include infections, autoimmune diseases, and toxins in the body. Pulmonophritis is a urinary tract infection that moves from the bladder and reaches the pelvis of the kidney, making it a form of nephritis. It is caused by kidney stones, infections in the bladder, catheter used to drain urine, and defects in the urinary tract. Signs and symptoms of pyelonephritis: high fever, blood and pus in the urine, pain during urination, pain in the back and sides, and urgent or infrequent urination, abdominal pain that radiates along the flank towards the back. Causes. Most causes of pyelonephritis starts off as lower urinary tract infections, mainly cystitis and prostatitis. Risk is increased in the following situations: mechanical, any structural abnormalities in the urinary tract, vesicular reflex, urine from the bladder flowing back into the ureter, kidney stones, urinary tract catheterization, urethral stents or drainage procedures, pregnancy, neurogenic bladder, and prostate disease in men. Risk is increased in such situations as constitutional situations, having diabetes mellitus, immunocompromised states, behavioral, change in sexual partner within the last year, spermicide use, positive family history, close family members with frequent urinary tract infections. Diagnosis: laboratory examination. Analysis of the urine may show signs of urinary tract infection, specifically the presence of nitrite and white blood cell on a urine test strip in patients with typical symptoms are sufficient for the diagnosis of pyelonephritis and are an indication for empirical treatment. Blood tests such as a complete blood count may show neutrophilia, microbiological culture of the urine with or without blood cultures, and antibiotic sensitivity testing are useful for establishing a formal diagnosis and are considered mandatory in this situation. Instrumental investigation. Investigations include kidney ultrasonography or voiding cystourethropy. CT scan or kidney ultrasonography is useful in the diagnosis of pyelonephritis. Serial imaging may be useful for differentiating this condition from kidney cancer. Kidney stones ultrasound, you can see on this picture. Treatment. What is the treatment of pyelonephritis? It is antibiotics. It is antiviral drugs, sometimes if it's necessary. It is drugs to reduce the pain, non-steroid anti-inflammatory drugs, for example. It is drugs to treat gastrointestinal function, proton pump inhibitors, for example. It is diuretics if it's necessary according to the indications. Sometimes it's chemotherapy. Sometimes the other drugs, for example, allopurinol. But on the first place are antibiotics and antiviral drugs. Interstitial nephritis is the inflammation of the kidney cells that are not part of the fluid collecting units, a condition that can lead to acute renal failure or kidney disease. The causes of interstitial nephritis are allergic reaction, side effects from medicines such as antibiotics, the long-term use of acetaminophen, which is found in Tylenol or non-steroid anti-inflammatory drugs. Symptoms of interstitial nephritis are blood in the urine, swelling, weight gain, nausea, fever, abnormal sounds in the heart and lungs. Diagnosis: a urinalysis, kidney biopsy, blood count, and blood creatinine levels are very necessary to diagnose the disease. Glomerulonephritis: inflammation of the glomeruli caused by a reaction to immune complexes and components. Glomerulonephritis can be an acute or chronic. Signs and symptoms of it: initial step infection, then urinary signs, hematuria, proteinuria, sometimes dark urine and decreased output, facial and ankle edema, due to hypoproteinemia and sodium and fluid retention, hypertension, of course, and possible renal failure. Diagnostic. To diagnose the disease, it's necessary to do creatinine clearance, total protein in the urine, urine concentration, urine specific gravity, urine red blood cells, and urine osmolarity. Blood tests may show anemia, which is a low level of red blood cells, abnormal albumin levels, abnormal blood urea nitrogen, and high creatinine levels. Antiglomerular basement membrane antibodies, anti-neutrophil cytoplasmic antibodies, anti-nuclear antibodies, and complement levels are very necessary to diagnose the disease. A biopsy of kidney may be necessary to confirm the diagnosis. This involves analyzing a small sample of kidney tissue taken by a needle. CT scan also is necessary to indicate kidney ultrasound, chest X-ray results, and intravenous pyelogram. Treatment. What are the treatment of glomerulonephritis? Of course, is dietary changes to reduce your intake of food that contain a high amount of salt, foods or drinks that contain a high amount of potassium, fluid, stopping smoking. It's necessary to prescribe immunosuppressants and corticosteroids. Or, for example, talking about immunosuppressants, cyclophosphamide. Cyclophosphamide is an immunosuppressant used in very high doses to treat some cancers. It's also an established treatment in much low doses for glomerulonephritis. So, for some cancers, high doses. For treating of glomerulonephritis, low dosages. Other immunosuppressants. Other medicines to help control immune system include mycophenolate mofetil, azathioprine, rituximab, cyclosporine, and tacrolimus. Symptoms of lupus nephritis. Lupus nephritis is a serious problem. Its symptoms, though, are not always dramatic. For many, the first noticeable symptom is swelling in the legs, ankles, and feet. Less often, there can be swelling in the face or hands. Other symptoms can vary from person to person and from day to day. They may include weight gain, high blood pressure, dark urine, foamy, frothy urine, the need to urinate during the night. Diagnosis and treatment. Tests used for diagnosing kidney problems include urine tests, blood tests, imaging tests such as ultrasound and kidney biopsy. Classification. Class 1 or first class is a minimal mesangial glomerulonephritis, which is histologically normal or light microscopy, but with mesangial deposits on electron microscopy. It constitutes about 5% of cases of lupus nephritis. Kidney failure is very rare in this form. Class 2, second class, is based on a finding of mesangial proliferative lupus nephritis. This form typically responds completely to treatment with corticosteroids. It constitutes about 20% of cases. Kidney failure is rare in this form. Class 3 or third class is a focal proliferative nephritis and often successfully responds to treatment with high doses of corticosteroids. It constitutes about 25% of cases. Kidney failure is uncommon in this form. Class 4 is diffuse proliferative nephritis. This form is mainly treated with corticosteroids and immunosuppressant drugs. It constitutes about 40% of cases. Kidney failure is common in this form, and class 5 or fifth class is membranous nephritis and is characterized by extreme edema and protein loss. It constitutes about 10% of cases. Kidney failure is uncommon in this form. Treatment: corticosteroids. These strong anti-inflammatory drugs can decrease inflammation. Doctors may prescribe these until the lupus nephritis improves. Because these drugs can cause a variety of potentially serious side effects, they must be monitored carefully. Doctors generally taper down the dosage once the symptoms start to improve. Immunosuppressive drugs. These drugs, which are related to the ones used to treat cancer or prevent the rejection of transplanted organs, work by suppressing immune system activity that damages the kidney. They include cyclophosphamide, azathioprine, or mycophenolate. And a few words about Goodpasture syndromes, another autoimmune disorder related to chronic kidney disease and inflammation in Goodpasture syndrome. This rare disease attacks both the kidney and lungs, eventually leading to kidney failure and lung disease. Subtle symptoms include coughing up blood, fatigue, trouble breathing, and nausea. Bleeding of the lungs can last from 2 weeks to 2 years, depending on the severity of the disease, likely leading to permanent kidney damage. Wegener's granulomatosis. It also affects kidney as well as the upper respiratory tract and lungs. Like lupus, the disease can attack nervous system, heart, skin, and joints, in addition to eye and ears, and the causes are unknown. Symptoms include constant runny nose, eye redness, and irritation, coughing up blood, fatigue, joint pain, and ear infection. The doctor will do a blood test that can detect certain protein in blood. Coupled with the blood test are urine tests, of course, chest X-ray, and a biopsy. Immunosuppressive drugs may be prescribed, but not all at once because each case is different. A kidney transplant can also be considered in case of Wegener's granulomatosis. And thank you for your attention. Be healthy. Goodbye.